Hair is often seen as a reflection of health and identity, so when it starts falling out, it can be alarming. Whether it's thinning over time, sudden patches of baldness, or excessive shedding, hair loss can affect confidence and leave people searching for answers. But what causes hair loss? Is it genetics, stress, or something more? In this video, we'll break down the most common causes of hair loss, how to recognize them, and what you can do about it. Before we dive in, make sure to subscribe to this channel to support this student-run platform. So let's get started. 1. Genetic hair loss, androgenetic alopecia. One of the most common causes of hair loss is androgenetic alopecia, also known as male or female pattern baldness. This type of hair loss is hereditary and happens gradually over time. In men, it often starts with a receding hairline and thinning at the crown. In women, it usually appears as overall thinning, particularly at the part line, without significant receding. This condition is caused by sensitivity to dihydrotestosterone, DHT, a hormone that affects hair follicles, causing them to shrink over time until they stop producing hair. While it can't be completely reversed, treatments like minoxidil, Rogaine, finasteride, Propecia, and hair transplants may help slow down the process or restore some hair. 2. Hormonal imbalances. Hormones play a major role in hair growth, and any disruption can lead to hair loss. Some common hormonal causes include polycystic ovary syndrome, PCOS. Excess androgens, male hormones, can cause thinning hair or hair loss in women. Pregnancy and postpartum changes. Many women experience thicker hair during pregnancy due to increased estrogen, but after childbirth, estrogen levels drop, leading to excessive shedding. This is known as telogen effluvium and usually resolves within a few months. Menopause. Estrogen levels decline, which can lead to thinning hair and slower regrowth. Managing hormonal imbalances through medical treatment, diet, and lifestyle changes can sometimes help slow down or reverse hair loss. 3. Stress and hair loss. Stress is a major but often overlooked factor in hair loss. There are 3 primary types of stress-related hair loss. Telogen effluvium, a temporary condition where stress pushes large numbers of hair follicles into the resting phase, causing excessive shedding a few months after a stressful event. Common triggers include illness, surgery, high fever, or emotional stress. Trichotillomania, a psychological condition where individuals compulsively pull out their hair due to stress or anxiety. Alopecia areata, an autoimmune disorder triggered by stress, where the immune system attacks hair follicles, causing patchy bald spots. Reducing stress through relaxation techniques, exercise, and a balanced lifestyle can help improve hair health over time. 4. Nutritional deficiencies. Hair needs the right nutrients to grow, and deficiencies in key vitamins and minerals can contribute to hair thinning and shedding. Some of the most common nutrient deficiencies linked to hair loss include iron deficiency. Low iron levels can disrupt hair growth and lead to excessive shedding. This is especially common in women with heavy menstrual cycles. Vitamin D deficiency plays a role in hair follicle cycling. Low levels may contribute to hair thinning. Protein deficiency. Since hair is made primarily of protein, keratin, inadequate protein intake can weaken hair strands. Zinc and biotin deficiency. These nutrients help support hair health, and their deficiency can lead to brittle hair and excessive shedding. Eating a balanced diet with lean proteins, leafy greens, nuts, and fish can help prevent hair loss due to nutritional deficiencies. 5. Medical conditions and medications. Certain medical conditions and medications can cause hair loss as a side effect. Some common causes include thyroid disorders, both an overactive hyperthyroidism and underactive hypothyroidism. Thyroid can lead to hair thinning. Autoimmune diseases. Conditions like lupus and alopecia areata can cause hair to fall out in patches. Scalp infections and skin disorders. Conditions like seborrheic dermatitis, psoriasis, and fungal infections can cause hair loss if left untreated. Additionally, some medications may contribute to hair loss, including chemotherapy and radiation, designed to kill rapidly dividing cancer cells, but also affect hair follicles. Blood thinners and beta blockers. Some medications for heart conditions can lead to increased shedding. Antidepressants and birth control pills. Certain hormonal medications can cause temporary or prolonged hair thinning. If you suspect a medication is causing hair loss, speak with a doctor about possible alternatives. 6. Overstyling and hair damage. While genetics and medical conditions play a big role in hair loss, daily hair care habits can also contribute to thinning and breakage. Common culprits include frequent heat styling. Excessive use of curling irons, straighteners, and blow dryers can weaken hair over time. Tight hairstyles. Ponytails, braids, and buns that pull on the scalp can cause traction alopecia, leading to permanent hair loss. Chemical treatments, relaxers, perms, and frequent coloring can damage the hair shaft and follicles, leading to increased shedding. Reducing heat exposure, using gentle hair products, and avoiding overly tight hairstyles can help preserve hair health. When to see a doctor. While some hair shedding is normal, significant or sudden hair loss may indicate an underlying issue that needs medical attention. You should consult a doctor if you are losing large amounts of hair suddenly or in patches. Your scalp shows signs of irritation, redness, or infection. Your hair loss is accompanied by other symptoms like weight changes, fatigue, or hormonal imbalances. A medical professional can help diagnose the cause and recommend treatments, whether that involves lifestyle changes, medications, or other interventions. Hair loss can be caused by a variety of factors, from genetics and hormones to stress and diet. The good news is that many forms of hair loss can be prevented, treated, or managed with the right approach. Understanding the cause of your hair loss is the first step in finding the best solution. If you found this video helpful, don't forget to like, share, and subscribe to this student-run channel. Your support helps provide clear, science-backed medical information while I continue my journey through medical school. Let me know in the comments if you have any questions, and I'll do my best to answer them. See you in the next video.